A raw bone from the butcher costs about $2. A dental cleaning at the vet runs $300 to over $1,000, and that is before they find a tooth that needs pulling. But a peer-reviewed study found that dogs chewing raw bones reduce the tartar on their teeth by nearly 88% in just 20 days, without anesthesia, without scaling tools, and without a single day of recovery. So why are millions of dog owners still paying hundreds every year for a procedure their dog's ancestors never needed? The invoice arrives and it is always more than you expected. You brought your dog in for a routine dental cleaning, and the receptionist at the veterinary clinic hands you an estimate somewhere between $400 and $800. That covers the pre-anesthetic blood panel, the general anesthesia itself, the ultrasonic scaling, the polishing, and the monitoring equipment that tracks your dog's heart rate and oxygen while they are under anesthesia. Then the veterinarian calls you mid-procedure. They found a tooth with advanced decay beneath the gum line. Extraction will be an additional $300 to $500 depending on which tooth it is and how deep the roots go. Some complicated extractions at specialty dental clinics run over $1,000 for a single tooth. This is not unusual. This is the normal cost of professional canine dental care across the United States, and it is a procedure that most veterinarians recommend at least once a year for small breed dogs like Yorkshire Terriers and Chihuahuas who are genetically prone to crowded teeth and rapid tartar buildup. Some veterinarians recommend it every 6 months. The question that haunts every dog owner walking out of that clinic with a lighter wallet is simple. Is there another way? To answer that, you need to understand what is actually happening inside your dog's mouth right now. According to the American Veterinary Medical Association, periodontal disease is the most common clinical condition in adult dogs. By the time a dog reaches 3 years old, roughly 80% of them already show some evidence of it. The Merck Veterinary Manual puts the number at 80% by age 2. Cornell University's College of Veterinary Medicine cites 80 to 90% by age 3. The exact number shifts depending on the study, but the conclusion is always the same. The vast majority of adult dogs are walking around with some degree of dental disease, and most of their owners have no idea. It starts with plaque, that invisible film of bacteria that coats the teeth within hours of eating. If nobody removes it, plaque mineralizes into tartar within just a few days. Tartar is that hard, yellowish brown crust you can see along the gum line. It looks bad, but the tartar you can see is not actually the main problem. The real damage happens below the surface, where bacteria work their way into the pockets between the tooth and the gum. Down there, they trigger an immune response that slowly destroys the ligaments and bone that hold teeth in place. Left unchecked, this process leads to loose teeth, infections that spread into the jawbone, and bacteria entering the bloodstream, where they can affect the heart, kidneys, and liver. Your dog will not cry about it. They will not stop eating from their bowl until the pain becomes unbearable. Dogs are stubbornly stoic about oral pain, which is exactly why the disease progresses so far before anyone notices. And here is where the math starts to get uncomfortable for every dog owner. So the veterinary profession's answer is professional cleaning under general anesthesia. And in fairness, there are things that only a proper veterinary dental procedure can do. The endotracheal tube protects the airway from debris. The anesthesia allows complete examination of every tooth surface, including the lingual side that a conscious dog would never let you touch. Dental x-rays reveal bone loss, dead roots, and hidden abscesses that look perfectly fine from the outside. Periodontal probing measures pocket depth around each tooth. These are things that simply cannot happen while a dog is awake and moving. But anesthesia is not without risk. A large-scale study examining over 157,000 dogs in the United Kingdom found that the overall risk of anesthesia-related death was approximately 1 in 1,000 for healthy dogs. For older dogs, the risk climbed significantly. Dogs over 9 years old faced nearly 13 times the odds of anesthesia-related death compared to younger animals. And dental procedures specifically carried 8.5 times the odds of death within 48 hours compared to diagnostic procedures. The absolute numbers are still small, but for an owner with a 12-year-old dog who needs dental work, those statistics carry weight. So you have a disease affecting 80% of dogs, a treatment that costs hundreds to thousands of dollars, and a procedure that carries real if modest risk, especially for the older animals who need it most. That combination is exactly why so many dog owners have started asking a different question entirely. This is where the raw bone enters the conversation. And to understand why it works, you have to look at something that existed long before veterinary dentistry was ever invented. Picture a gray wolf pack in Yellowstone National Park standing over a freshly killed elk in the snow. The wolves do not start with the bones. They tear through the hide first, ripping long strips of muscle tissue away from the carcass. They pull tendons, shred cartilage, and gnaw through connective tissue wrapped around joints. Every single meal is a full mouth workout that lasts anywhere from 20 minutes to over an hour. Researchers studying gray wolf skulls at the Yellowstone Heritage and Research Center have documented that when prey is abundant and wolves do not need to gnaw bones heavily, their teeth remain clean, sharp, and free of significant tartar buildup. Dental disease in wild wolf populations under normal prey conditions is rare. A study of Iberian wolf skulls from museum collections in Portugal found that fewer than 9% showed dental changes. Their teeth stay clean not because of some genetic advantage domestic dogs have lost, but because of what they eat and how they eat it. What makes this even more interesting is what happens when food gets scarce in places like Yellowstone and Isle Royale. A 2019 study published in the journal eLife found that when the ratio of elk to wolves dropped in Yellowstone, the wolves consumed more of each carcass, chewing deeper into the bones. And when that happened, the rate of tooth fractures more than doubled. In Scandinavia, where moose outnumbered wolves by nearly 500 to 1, broken teeth were uncommon. The wolves could find prey easily, skip the dangerous bone chewing, and move on to the next kill. That tells us something important. Wild canids are not immune to dental damage from bones. They simply eat the right parts of the right animals most of the time. And those right parts, the meat, the gristle, the cartilage, the soft connective tissue, are what keep their teeth clean. The key is not the bone itself, but the entire act of processing a raw carcass. When a wolf tears strips of raw meat and connective tissue away from bone, those fibers slide between the teeth and along the gum line like a rough, natural form of flossing. The cartilage and gristle scrub the tooth surfaces. The abrasive texture of raw bone scrapes away plaque before it can harden into tartar. Saliva production increases during heavy chewing, and saliva contains enzymes that help neutralize oral bacteria. The whole process is dental hygiene built into the act of eating. Domestic dogs lost access to this system when we started feeding them kibble from a bag. Kibble is convenient, shelf-stable, and nutritionally complete on paper, but from a dental perspective, it does almost nothing. Most dry food shatters on contact with the tooth surface. It does not scrub. It does not floss. And many commercial dental chews, marketed as alternatives, are carbohydrate-based, which actually feeds the plaque-producing bacteria they claim to fight. So what happens when you give a domestic dog the one thing its mouth was designed to process? In 2016, researchers in Brazil published a study in the Journal of Veterinary Dentistry that tested this question. They took 8 adult beagle dogs with established dental calculus and gave them raw bovine bones daily across 2 study periods. In the first phase, each dog received a piece of cortical bone, the dense outer layer of a beef femur, weighing about 122 grams. After just 3 days of chewing, the tartar covering their teeth dropped by 35%. By day 12, the reduction reached 70%. In the second phase, the dogs received spongy epiphyseal bone, the softer knuckle end portion of the femur, weighing about 235 grams. The results were even faster. After 3 days, tartar dropped by 56%. By day 12, the reduction hit 81%. And by day 20, calculus coverage had fallen by nearly 88%. The researchers noted that no dogs in the study suffered cracked teeth, gum injuries, or digestive blockages during either phase. Those numbers are striking. An 88% reduction in dental calculus from a piece of raw bone that costs less than the gas to drive to the vet clinic. But before you stop at the butcher counter tomorrow, there is a critical detail that separates a successful bone-chewing routine from an emergency veterinary visit. Not all bones are created equal, and the wrong bone can cause exactly the kind of damage you are trying to avoid. Think of it this way: there is a reason wolves avoid crunching through the dense leg bones of a full-grown bull moose when they have the option. Those weight-bearing bones evolved to support hundreds of pounds of animal. They are often harder than the enamel on a dog's teeth. The veterinarians and integrative practitioners who advocate for raw bones almost universally agree on one point. The bones of medium-sized animals are the safest and most effective choice. Lamb ribs, lamb shanks, and goat bones from the butcher counter hit the sweet spot. They are hard enough to scrape tartar, but not so dense that they crack teeth. Raw chicken necks and wings work well for smaller dogs and terrier breeds, though they are soft enough that they provide less scrubbing action on larger teeth. The bones to avoid are the weight-bearing bones of large animals. Beef femurs, bison shanks, and the dense leg bones of cattle are harder than your dog's teeth. Veterinarian Peter Dobias, who has over 35 years of integrative veterinary experience, puts it bluntly. A $2 marrow bone can turn into a painful and very expensive adventure if your dog cracks a premolar on it. The upper fourth premolar is the tooth most commonly fractured during aggressive bone chewing because dogs naturally apply their strongest bite force through those back teeth. A single cracked tooth can lead to a root canal or extraction costing $500 to $2,000 at a veterinary dental specialist. So how do you get the cleaning benefit without the fracture risk? Cooked bones are off the table entirely. Cooking changes the molecular structure of bone, making it brittle and prone to splintering into sharp fragments that can puncture the esophagus, stomach, or intestinal lining. Every emergency veterinarian has pulled cooked bone shards from a dog's digestive tract. Raw bones bend and crush under jaw pressure. They shatter into daggers. If you are starting a bone routine, the guidelines from experienced raw feeding veterinarians are consistent. Choose a bone larger than your dog's mouth so they cannot swallow it whole. Supervise every session. Limit chewing time to 15 to 20 minutes, 2 to 3 times per week. Remove the bone once the meat and cartilage have been stripped and only bare, hard bone remains. That bare bone is where the fracture risk escalates. And never give raw bones to puppies whose adult teeth have not fully come in. If you have found this helpful so far, consider subscribing. We cover pet health topics like this every week, always grounded in published research and real veterinary perspectives. Now here is where the conversation gets more complicated and where intellectual honesty requires acknowledging what a $2 bone cannot do. The American Veterinary Medical Association, the American Animal Hospital Association, and the American Veterinary Dental College all maintain formal position statements emphasizing that proper dental care requires general anesthesia. Their reasoning is not simply about protecting revenue, it is about what happens below the gum line. Tartar on the visible surface of the tooth is cosmetic. The disease that shortens lives and causes chronic pain lives in the subgingival pockets, those gaps between the tooth root and the surrounding gum tissue where oxygen-starved bacteria thrive. A raw bone can scrape the crown clean, but it cannot reach into a 3mm periodontal pocket and remove the biofilm clinging to the root surface. Only professional scaling instruments guided by trained hands can do that, and doing it on a conscious animal risks lacerating the gums or driving debris deeper into the pocket. Then there is the diagnostic gap. Visual examination of a dog's mouth, even by an experienced veterinarian, misses an estimated 50 to 60% of dental pathology. Fractured roots, resorptive lesions, jawbone infections, and early oral tumors all hide beneath the gum line where they are invisible without dental x-rays. A dog can have gleaming white teeth above the surface and a festering abscess below it. Bones will never detect that. Only a complete oral examination under anesthesia with full mouth radiographs can catch those problems before they become emergencies. And this brings up another option that has been gaining popularity, one that sounds like a reasonable middle ground but has drawn sharp criticism from the veterinary establishment. The anesthesia-free dental cleaning trend adds another layer to this discussion. These are services, often offered at pet stores or grooming salons, where a technician scrapes visible tartar from a conscious dog's teeth. They cost between $100 and $300, and the teeth look noticeably cleaner afterward. Every major veterinary organization opposes them. The 2019 AAHA Dental Care Guidelines specifically call the practice unacceptable because of patient stress, injury risk, aspiration danger, and the complete absence of diagnostic capability. The American Veterinary Dental College has maintained a position statement against non-anesthetic scaling since 2004. Their concern is not that the teeth look dirty afterward, it is that the teeth look clean while disease progresses invisibly underneath. So where does this leave the dog owner standing in the kitchen, holding a lamb shank in one hand and a veterinary invoice in the other? The honest answer is that both tools belong in the picture, but they do different jobs. Raw bones are prevention. They are maintenance. They are the daily equivalent of brushing your own teeth, except that fewer than 1% of dog owners actually brush their dog's teeth every day, which means for the vast majority of dogs, bones represent the most realistic form of ongoing dental care they will ever receive. Professional veterinary cleaning is intervention, the deep clean that addresses disease already established below the gum line, the diagnostic screening that catches hidden problems. For a dog that already has advanced periodontal disease, loose teeth, or signs of oral infection, no bone in the world is going to reverse that damage. That dog needs professional care. But what about the dog that does not have advanced disease yet? What about the puppy you just brought home? Or the 3-year-old whose teeth still look fine? This is where the financial math gets interesting, and where it rarely gets discussed. A dog that receives raw bones 2 to 3 times per week from the age of 1 may never develop the level of tartar and gum disease that triggers the need for annual professional cleanings. 2 raw lamb ribs per week cost roughly $3 to $5. Over a year, that is approximately $150 to $260 in bones. Over a 12-year lifespan, that is somewhere around $2,000 to $3,000 in bones, assuming you never get a discount from your local butcher, which you almost certainly will. Compare that to a dog that gets a professional dental cleaning every year, starting at age 3, at $400 to $800 per cleaning. That is between $3,600 and $7,200 over 9 years of cleanings. Add in even one extraction event, which commonly runs $500 to $1,000, and the lifetime dental cost can easily exceed $8,000. The $2 bone does not replace the $500 cleaning, but it might mean your dog needs far fewer of them, or none at all. A veterinary practice in Australia that has been recommending raw bones for decades reported something their staff noticed over years of clinical observation. Dogs that regularly ate raw bones almost never needed dental cleanings at any age. The clinic could identify them on sight: white teeth, pink gums, fresh breath. Meanwhile, the dogs on kibble-only diets reliably showed up with tartar-caked teeth and inflamed gums by middle age. Same breeds, same neighborhood, completely different mouths. That observation matches the data from a survey of 479 dogs that found a statistically significant correlation between regular raw bone feeding and better periodontal health. Dogs who got bones had less disease. The more frequently they received bones, the healthier their mouths. But does that mean you can just hand your dog a bone and walk away? Not quite. None of this means bones are magic. They carry their own risks that deserve the same honest look we gave the veterinary cleaning. A dog that chews too aggressively on a bone that is too hard can crack a tooth, and a cracked tooth often requires extraction under anesthesia, which is the exact procedure you were trying to avoid. A dog that swallows a large chunk of bone without chewing it properly can face an intestinal obstruction that requires emergency surgery. Some veterinarians also point to the bacterial load on raw meat surfaces, including potential salmonella and listeria contamination, as a concern for immunocompromised animals and their human family members. These outcomes are uncommon with proper bone selection and supervision, but they are not impossible. The key phrase there is proper selection. Just as you would not hand a toddler a steak knife and leave the room, you do not toss your 70-pound Labrador a bare beef femur and go run errands. So what is the bottom line for the dog owner trying to do the right thing? The conversation about dog dental health is bigger than any single product or procedure. Understanding the biology your dog inherited from thousands of generations of raw-eating ancestors means recognizing that we removed a critical piece of their dental maintenance system when we transitioned them to processed food. We gave them nutritionally complete kibble in a bowl, and in exchange, we took away the mechanical cleaning that kept their mouths healthy for tens of thousands of years. The bone is not a miracle cure. It is a missing ingredient. 80% of dogs develop dental disease by the time they turn 3, and most of their owners will not know until the bill arrives. A few dollars worth of raw lamb rib each week might change that equation entirely. Your dog's mouth was built for a job that most of us stopped letting it do. Whether a $2 bone from the butcher belongs in your routine is a conversation worth having with your veterinarian, one informed by the evidence, not just the invoice. If you want to see what other common pet care costs might be lower than you think, that video is on screen now.